Welcome. So tell me, are you ready for that Obama health care? Get this, the state has decided they need to put together a blue ribbon commission to find out how to do this most cost effectively. On that commission is our very own Linda Gorman, who takes care of our health care policy at the Independence Institute. Congratulations. And I'm really sorry.
Yes, thank you, I think.
Yeah. All right, so your role on this new commission is what?
I was appointed to the health economist slot. I'm not sure.
Because you're an economist.
Because I am, yes.
All right. This is known as the Senate 187 commission. That was the bill that made this commission.
Yes.
All right.
It was.
And the overriding goal with this is to do what?
Well, it depends on how you read the bill, but I think the idea is to find out what major cost drivers are for Colorado and then make recommendations about how to reduce Colorado healthcare costs. And we have a budget.
You have a budget?
$400,000 hard-earned taxpayer dollars.
Wow. Of that, how much do you get paid?
Zero. Travel costs maybe. But I've already saved the taxpayers money.
How so?
Because they were debating about whether the organizing committee should be 5 or 7 members. And the legislation says that we can meet in groups of 5 or fewer without violating the Open Meetings Act, but they had nominated 7 people. They were going to hire counsel. I said, why not just cut it back so we don't have to do lawyers?
No lawyers?
No lawyers. I saved
right,
the
so
taxpayers'
now
money.
All right. Colorado has its own Obamacare. It has health care for Colorado. As the economist of this group, and there are representatives from hospitals and the representatives from insurers and the representatives supposedly for consumers, and then a whole bunch of busybodies who are supposed to know the ins and outs of how insurance works. Where is this going to go? I mean, there's always this statement, we're going to find cost savings. I spent time at the Regional Transportation District. They would have meetings that were called public outreach meetings to decide what the community wants in a certain corridor. And everybody knew what the hell it was going to be long before it happened. And lo and behold, they wanted light rail everywhere. So call me skeptical. What should we be on the lookout in this committee?
Well, I think it represents a tremendous opportunity to finally take a look at regulatory costs and the costs of government health programs. If the Commission really wants to credibly look at things, we'll look at what the state does to increase healthcare costs, because the state can only affect what the state does.
What do you mean the state can only affect what the state does?
I mean, the state can pass a law that says you have to treat everybody for free, but unless we get rid of, prohibitions against slavery, it can't make people do that. So what the state can do is reduce the cost of practicing medicine in Colorado by reducing licensing costs, by, reducing some of the regulatory costs that cause healthcare providers to have to spend a whole bunch of money. And it can reduce some of the things in its own healthcare programs that are very expensive, that don't work very well. For example, managed care costs the state more money than it saves in Medicaid.
Give me a definition. Managed care is what?
Managed care means that the state pays a particular amount for each person enrolled with a particular health care system. Like Denver Health gets paid X amount of dollars for each person that's the Medicaid program enrolls there. And that's different than fee-for-service, where you just pay the hospital for the services that it provides. And everybody thought managed care would be less expensive.
Kind of like an HMO? Is that the idea?
HMO is managed care, yes.
So that everybody pays the certain amount, and we have this big pot of money, and we're going to decide how to divvy it up and try to give everybody the best service we can. That's the HMO model. The cash for care model.
It's also the single payer model in countries. We collect all this tax revenue, we just divide it up however the political system does, and you get the care we can provide you.
Because those who are best at screaming in those systems get more of that money. If you're politically connected and you're
a lawyer,
and if you're part of a community that's pushing for more money in this area, if you have a politically active group, maybe breast cancer or AIDS or something, that more money might be funded there. If you're in a disease
like prostate cancer doesn't get as much funding as breast cancer, for example.
Yeah,
it kills more people.
Those are just men. They're just men.
It's war on men, but the war on women is popular. Same idea.
All right. Fee for service means you come in and you will get charged for what was done.
Right.
And is that a better cost savings when it comes to health care for Colorado?
According to the state, in about 2006, they were paying more under Medicaid managed care than they were if they just did fee-for-service, but they were going to keep doing managed care. The Robert Wood Johnson Foundation has just done a consensus report that says Medicaid managed care doesn't really save any money, but states are still doing it because they're still doing it. So that's one thing we could look at.
Why are states still doing it?
I have no idea. I hope that's something we can find out.
Let me ask you, so this commission is there. Are you looking forward to this as a real opportunity to find cost savings? Or, and let me give you my suspicion, that this is a nice procedure that a lot of people hope will bring us closer to single-payer care in Colorado.
I think there are undoubtedly some people in the state who hope that's what happens, that it provides a research basis for saying, well, if we just get rid of all the middlemen in healthcare and let the state do it, it'll be cheaper. And they've won that argument already in Connecticut and Vermont, which have passed laws that revert to state single-payerdom. It would be a huge mistake, and the commission says it has to be evidence-based. All the evidence suggests that you cut costs by giving power to the people, giving people budgets, letting them spend it on health care, freeing the providers, and moving towards cash. So if the commission says, oh, we need to have the state control things, get rid of the middlemen, then they're going to be cherry-picking a lot of the evidence, in my opinion, because I think that the evidence shows something quite different.
In those states where they have this single payer, is this is just for people on Medicaid?
No, this is the entire state. Their idea is they're going to collect every insurance premium in the state, and everybody's going to divvy up the money, and you're going to get treatment, and the state's going to pay for it.
What about people on private insurance plans that...
you pay your premium, the state takes the money.
Well, hang on. I need to understand this better. So back it up a little bit so I can understand it on my level.
You can be as cynical as you want here.
No,
Yes.
I'm really trying to understand this. So in these states, we already have a single-payer system for everybody in that state.
They have voted it. They're not operational yet because the costs are proving to be more than expected, or they're just beginning. But they have already voted to do it.
In that case, does the state basically become a huge HMO?
Not necessarily, because you could buy a plan that is a PPO plan. They still collect your money. But the question is whether it's going to be less expensive than having insurers do it. And the answer is probably not, as far as we know, because for one thing, the state has absolutely no incentive to look for fraud, whereas private profit-based insurers do. They look for fraud much harder than the government does, which is why fraud is rampant in Medicaid and Medicare. One of the funniest things was when the government made such a big deal about putting all the Medicare payments online, and you got all these newspaper stories about how much individual physicians were being paid, et cetera, et cetera. The government already knew that. If there's fraudulent payments going on, why didn't they take care of it? That was
because
just theater.
It doesn't affect their bottom line.
That was just theater. They don't, yeah.
So
the VA, the fraud's been going on in the VA for decades. You know, patients have been harmed in the VA for decades. It's been known for decades. Why haven't they done anything about it?
Because there's not a financial incentive to do it.
No
in fact,
incentive
there's a financial incentive to keep it going, because if they run out of money, then there's a call to get more money into it.
The bigger the scandal, the bigger their budget, right?
Whereas when you have private carriers doing it, when they find that fraud, that's cash on the barrelhead for them. They get to keep it when they stop it.
To some extent, yes. It's even a bigger incentive for individuals to have the money to spend paying cash. You will never see a more careful shopper than somebody who's hauling money out of his own health savings account or his own pocket to pay for care. They bargain like crazy.
Give me an example of that. We've only got about a minute, but the idea that you've always pushed is the idea of saying, give cash directly to people. Let people do their own health care shopping up to a certain level, and then there's catastrophic care for when they get hit by a light rail. What does that look like, and where has it worked?
It works in Medicaid in Colorado. People get budgets for attendant support. They hire their own attendants. They pay them what they want. They save considerable amounts of money doing it. The state used to let them keep half of what they saved, and the state spent 20% less. That's one example. There are many, many examples out there. There are people now who go to cash-only clinics for outpatient surgery and save 30%. I saved about 20% over what I would have paid a hospital when I negotiated hernia surgery for cash. So you can do it, and it works well. Just need the
10
incentive.
seconds. How long until this commission wraps up its work?
Years.
Years?
Years.
It's job security for you.
Yes.
If only you got paid, it would be great. Linda, thank you. Thank you. Listen for me on KHOW Radio. Check out the Independence Institute at independenceinstitute.org, and we'll see you next week.